Regarding investigations for breast cancer, once by clinical examination we diagnose that the patient has a breast lump, we next move on to imaging techniques. So, imaging means it is either an ultrasound or an MRI or a mammogram. Why an imaging is done is to characterize the lesion, to look for the size of the lesion, to see whether it is involving the skin over the breast or the muscles under the breast, whether it is fixed or how it looks, like it looks benign or it looks like a cancerous lesion. So, the imaging is decided according to the age of the patient. In case the patient is less than 40 years, like 35 to 40 years and less than that, the breast tissue is very dense. So, we go for an MRI if we are highly suspicious of malignancy. MRI gives a better picture as the breast tissue is dense in the younger age group. After the age of 40 years, we go for an mammogram. A mammogram is gold standard and gives us an idea of whether the lesion is looking like a cancer, whether the axillary lymph nodes are involved or not. After the mammogram, that is after the imaging technique, we then go for a biopsy. Either image guided FNAC or a true cut biopsy is done. We remove the tissue from the breast mass and then it is examined under a microscope to tell us what kind of breast cancer lesion it is. Following the final histopathology report, we decide on the treatment options for the patient.